If you are motivated to try and reduce your risk of getting diagnosed with prostate cancer, what can you do? Well, 2 large studies have been conducted using drugs that are currently on the market to treat men that have an enlarged prostate. They're called finasteride and dutasteride. And they work by stopping the body from converting the male hormone called testosterone into something that's even more potent called dihydrotestosterone. The hope was that perhaps these would also reduce the risk of getting cancer. In the first study, the finasteride study, men took the drug 5 milligrams a day or a placebo, an inactive drug, and they did that for 7 years. At the end of the 7 years, a biopsy was advised, and although not all men had a biopsy, the results showed that there was a reduction in the risk of getting diagnosed with prostate cancer. About 1 out of every 16 men who took the drug avoided that diagnosis. There were some side effects. Men had some difficulties with sexual function in about 2 to 4%. And there were also some other benefits, namely that men were less likely to end up with surgery for an enlarged prostate and less likely to develop urinary retention. The second study was done in men that had already had a previous biopsy that was negative for cancer. They were thought to be at higher risk of being diagnosed with cancer in the future. They took the drug or a placebo once a day for a total of 4 years. Biopsies were recommended after 2 years and again at the end of the study. This study showed that there was also a reduction in the risk of getting diagnosed with cancer. About 1 out of every 20 men avoided that diagnosis. Here too, there were somewhat similar side effects as that seen in the finasteride study. Now there are some questions and concerns. Number 1, in both studies, there was a slightly higher risk of getting diagnosed with a more aggressive or more dangerous cancer. Some people have wondered whether or not the drug may have made some cancers worse. The proponents of the use of this drug have said that's not really the explanation. What happened is the drug shrinks the size of the prostate, and when men have a biopsy, it's easier to find these cancers compared to men who don't take the active drug. Nevertheless, an FDA panel has decided that at this time they're not going to give approval for these companies to market the drugs for that purpose. They believe that there's not enough safety information at this time to give that approval. So anyone who wants to take the drug can get a prescription from their physician, and it's worth having a conversation about this with your doctor if you're motivated. But at this time, there's no formal indication for the use of the drugs to prevent this disease. Now, there are other questions that are still not answered, namely, do you have to stay on the drug for the rest of your life, or will you continue to benefit by taking it for only a short time? There's going to be additional studies necessary to answer those questions. But the bottom line is, if you're motivated to want to do something to reduce your risk of getting diagnosed with cancer of the prostate, then finasteride or dutasteride may be worth considering, recognizing there are these concerns that have not yet been fully resolved.